everyone, I'm Anastasia signing in from NORAS. In today's session, we will be discussing about care of patient with ostomies. An ostomy is a surgically opening which is created in the urinary tract or in the intestine where the effluent such as the fecal matter, the urine, or even the mucus will be rerouted to the outside of the body using the artificially created opening called a stoma. A stoma typically protrudes over the skin. It can be pink or reddish in color. It can be round in shape. It is moist as well as there may be no nerve sensation. These ostomy surgeries are generally performed when the part of the bowel or the urinary system is diseased and therefore removed. So here, these waste substances, the fecal matter, the urine or the mucus is known as the effluent. And here an ostomy will be named according to the part of the intestine which was used to construct it. Here, for example, we can look at the colostomy. Here, a colostomy is a creation of a stoma from a part of the colon, which is the large bowel, where the intestine will be brought through the abdominal wall and will be attached to the skin. And because of this, it will divert the normal intestinal fecal matter through the stoma instead of the anus. If an opening is being made in the colon, then it will be known as the colostomy, whereas it can be named as ileostomy if an opening has been created in the ileum, which is the small bowel. There is also another opening which can be made known as the urostomy. So here a stoma can be created using a piece of the intestine in order to divert urine to outside of the body. So here, when we make this opening, the ureters will be stitched to a part of the intestine which would be brought through the abdominal wall and it would be sutured in order to create a stoma. So here, usually if a person is having a bowel cancer or if he is suffering from inflammatory bowel diseases, then for these type of patient, an opening known as the urostomy can be made. An ostomy can either be temporary or permanent depending on the reason why this opening has been made. The other types of ostomy also include the jejunostomy, the double barrel ostomy, as well as the loop ostomy. So here, depending on the condition of the patient, depending on the reason why the ostomy should be done, we will be deciding which site must we make this opening. Since we have learned what an ostomy is and what are the different types, now let us move on to the procedure. Here, as always, before we perform any procedure, we must wash our hands in order to prevent cross-contamination. We must also gather all the equipments and supplies. So here it is important that we make sure we gather all the articles which would be required for this procedure, and that includes an ostomy bag, a flange, clip, scissors, stoma measuring guide, a waterproof pad, a pencil, and adhesive remover for skin, a skin prep, stomahesive paint or a powder, a wet cloth, the non-sterile gloves, as well as the additional cloths. So here, before we perform an ostomy, we must make sure that we gather all these articles, all these equipments. So here, after you have performed hand washing, after you have gathered all the equipments, you must place these equipments in the patient's bedside. Here it is also your responsibility that you explain the procedure to the patient. Here, before you explain, you must identify, you must make sure that you had identified the correct patient for which this procedure has been ordered. Here, you can educate the patient, you can explain the procedure to the patient as well as to the family members. You must encourage the patient to participate in the procedure as much as possible and also assist them in completing the procedure. Here, by encouraging the patient to participate in the procedure, it also allows them, it also encourages them to adjust to having an ostomy. You must provide privacy to the patient in order to enhance their comfort level. Then you must place a waterproof pad under the pouch. Here, by placing a waterproof pad, it would help to prevent the spilling of the effluent on the patient as well as the bed sheet. And since here we are discussing about care of ostomy, so here once the pad has been placed, you must make sure that you wear your gloves before you touch the bag, and you must remove the ostomy bag as well as you must measure and empty the content. Once this has been done, you must place the old pouching system in the garbage bag. Why we do this? We do this in order to prevent transmission of microorganisms. You can then remove the flanks by gently pulling it towards the stoma. Here, by pulling gently, it would help to prevent skin tear. You must support the skin with the other hand. Here, in order to remove the adhesive, you can use the adhesive remover. But if the rod is in situ, then we must not remove it. Okay, so here, why do we use the adhesive remover? Here, by using this remover, as it can decrease the skin and hair stripping. So once the flange has been removed, you can then clean the stoma gently by using the warm water. Here we must make sure that we do not use any soap. Here it is very important to know that cleaning of the stoma must be done gently, because gentle cleaning is very important, as an aggressive cleaning can cause bleeding. So here, after cleaning, you must also assess the stoma and the peristomal skin. Because here, as I have told you, that a stoma must be moist, it must be pink or reddish in color, and it must be above the skin. And the skin that surrounds the stoma should be intact. It should be free from any infection. It should be free from wound, rashes, or even skin breakdown. So here, while you are assessing the stoma, while you are assessing the skin, if you find that there is any abnormalities, it is your duty to report it and to notify it to the physician. You must also measure the stoma diameter by using the measuring guide, and also you must cut the stoma hole. You must trace the diameter of the measuring guide onto the stoma. You must trace the diameter of the measuring guide onto the flange and cut on the outside of the pen marking. So here normally the opening must be 2 mm larger than the stoma size. You must prepare the skin and also apply the accessory products as required or even according to the agency policy. And these accessory products can include the stoma adhesive paste or the powder or any other products which can be used to create a skin sealant in order to adhere the pouching system to the skin to prevent any leakage. Here you must then remove the inner backing of the flange and apply the flange over the stoma. You must leave the body tape on, you must apply pressure, and you must also hold it in place for at least 1 minute in order to warm the flange and also to mold it to the patient's body. Because here the warmth of the hand can help the appliance adhere to the body, and this would prevent leakage. And once this is done, we can then remove the outer border packing and then press it gently in order to create a seal. However, if the rod which is used here is in situ, then we must carefully move the rod back and forth, and we must make sure that we do not pull it. So here, once these steps has been done, we can apply the ostomy back and we can also clip it to the bottom. And once these steps are done, we can then apply the ostomy back. Here we must attach the clip to the bottom of the back, as this would prevent the spillage of the effluent. We must hold the palm over the ostomy for 2 minutes in order to assist the appliance to adhere to the skin. After which we must clean up the supplies. We must place the person or the patient in a comfortable position. We must replace all the articles in their proper places and also discard the ones that need to be discarded. Why do we do this? It is very important to do this in order to prevent cross-contamination. And once this is done, we can perform hand hygiene and we must document the procedure. Here, while documenting the procedure, It is very important that we mention the time, the date, as well as the procedure which was performed, what was the client response, as well as their concern. So here, these are the various steps that you need to follow when you are providing care to a patient with an ostomy. Here, as a nurse, there are also certain points that you must keep in mind. The first one is when the patients are discharged from an acute care facility, it is your responsibility to ensure that they have referral to a community health center in order to seek for help. And if the patient has had an ileostomy or a colostomy, then you must also make sure that they have been referred to a dietitian so that they can follow their dietary pattern. And patients must also be referred to a dietitian for new dietary needs related to ileostomy or colostomy. So these are the special consideration that a nurse must keep in mind before you discharge the patient from the hospital. So now here we have come to the end of this topic, whereby in today's session we have discussed about the care of patient with ostomies. I hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.